Well, most of us sometimes wake up in the morning and I say, oh my God, my brain is all fogged up, right? I mean, that's just saying, hey, my brain is, I can't think straight. I mean, that's what at least I mean when I say brain fog, right? I'm like, oh my God, I can't think of anything. But what exactly does it mean? What exactly does it mean, brain fog? That's the topic I want to bring today with a naturopathic doctor who will tell us exactly in medical terms what it means when you say brain fog and what kind of issues that it could have, if we don't treat it. So this is what we want to talk about with Dr. Eva. She should be joining me in 1 second. And bring on your questions about brain fog, because I know I do get brain fog, in not in a literal sense, but when I can't think straight. So Dr. Eva should be joining me. So hang in for 1 second and while I get her in. All right, so we will be talking about symptoms of brain fog. What exactly is brain fog? There you are. Hello, Dr. Eva. How are you?
Good, good. How are you?
I'm doing great. Thank you.
Wonderful. Thanks for having me on today.
Absolutely. So I was just, talking about, all of us make a joke about brain fog, right? Hey, my brain is all fogged up. I can't think about it. But in reality, it's a serious health concern, and
Yes,
that's
it
what
can
we,
be.
yeah, and that's what we are talking with Dr. Eva yacobi, who's a naturopathic doctor, and she's going to talk about what exactly is brain fog.
Well, brain fog is it comes from a few different things, but the primary piece is boils down to mitochondrial health. Because brain fog, yes, it's that sense of being like fuzzy, right? You can't
Yeah.
quite turn your brain on in the morning or in the afternoon or at really anytime throughout the day,
Yeah.
where you can't find your words, you can't, make your connections, you can't just get up and get going. It's just like, I need my coffee, right? But really, ultimately, with brain fog, what we could be looking at are things like nutrient deficiencies or heavy metal toxicities or long-standing viral issues, like let's say Lyme disease. We've seen it in current day as well. Um, and but and I say it ultimately boils down to mitochondrial health because that's where our energy comes from. That's where our clarity comes from. And whether you're dealing with something like a virus or you're dealing with something like an autoimmune disease, let's say with Hashimoto's, a lot of times one of the common denominators is mitochondrial health.
And mitochondrial health is very important, right? For our function, all the functions, the metabolic functions in our body. How do I know that? What are the symptoms? How do I know I have brain fog? Like, despite like my not thinking straight, I need a boost of coffee.
Well, I think you can generally identify it, right? As far as, because it's kind of like before I used to be able to get up and be clear, or I could get up, I can start going with like going into my day with or without coffee, with or without any kind of stimulants. Maybe I have some water and my head is clear and I can move forward. But the difference comes is when you're pulling yourself out of bed and it's like there's a veil somewhat, right? And it can come, one element I didn't include are food sensitivities, right? So, there's usually some kind of trigger. So it's a kind of a before and after event. So before I ate something that might be a food sensitivity, or maybe before I had Lyme's disease, or before I had a significant stress, I was clear. But now all of a sudden something is different.
Yeah.
Right?
That's right. So now let's talk a little bit about how naturopathic medicine can help.
Well, naturopathic medicine it's going to help on a lot of different levels, right? We do a lot of specific testing. We want to see what is the true root of what's going on. Because again, like I said, it could be food sensitivities, it can be nutrient deficiencies, it can be something like Hashimoto's, but if you just kind of start throwing mud at the wall, then you don't know what you're really dealing with. So we do start with a very, very long, you know, medical history and looking at all the lifestyle factors and determinants of health. But then we're going to look at your blood labs that you go your well, we do a larger panel of blood work plus some specialty tests. So if we're suspecting of viral illnesses, we're going to be looking at a whole slew of mitochondrial, let's say your mitochondrial health. We're going to be looking at your nutrient health. One of the major tests I use is a organic acids test because it looks at your gut microbiome plus your mitochondrial health plus B vitamins, etc. We'll look at viral panels, and we assess also your basic blood work different than, let's say, the conventional world. Right, we're looking for functional markers. So first we'll do generally a deep dive, and then it's really going after it with food, with daily habits, right? Are you getting to sleep on time? Are you drinking enough? What is the quality of your water? What is the quality of your environment? What is the quality of your food? What kinds of potentially herbs and nutrients are going to be needed to either help you heal from, let's say, some kind of viral or mold. I haven't brought up mold, but mold is another element. But what kinds of herbs specifically do we need to incorporate? And go from there.
Somebody's asking a question. Do you take patients from different states? So we have a lot of wellness programs actually that we have launched, which anyone in the world can do that, and that's why we launched those programs. As specific to Dr. Eva, I don't know if you take patients out of state or not, but that was the question that came.
Yeah, to speak to that, I do take patients, or I should say I work with clients out of state as a naturopathic consultant. So absolutely, I work with them slightly different than I would as being licensed in California and Connecticut. But when I'm working with people outside of state, I absolutely do that, but it's a little bit different.
Sure. And send us a send us a message, like what somebody asks a question, you just direct message us and then we can help you. But let's just continue with the brain fog part. All right, so you're talking about so many different things can impact brain fog. Are you sleeping properly?
Yeah.
Are you taking the right nutrients? Is there any herbs or anything? I mean, what is the toolkit, right? That's what I want to understand that you're going to use for helping people who have brain fog.
Well, it does depend, right? If you are dealing with some thyroid adrenal concerns, then I'm going to look at more of adaptogens and herbs and blends of that type. If we're looking at, a I should say like a dizziness, potentially I'm suspecting less circulation to the brain. Maybe somebody also has low blood pressure. I'm going to use herbs like bacopa and ginkgo, which are specifically for increasing circulation to the brain. And so that's where it really depends, because given the root cause, right? If we're looking at Lyme or mold, I'm going after the gut, because once we can heal the gut, we're going to open up the mind and we're going to clear the fog. Or if it's food sensitivities, I'm going to remove the foods that either we've tested for, or I'm suspecting, or we've done an elimination diet and we've discovered these 3 foods or 10 foods are what need to be removed.
So makes sense. So the step 1 is obviously, people come to you for symptoms, and then you do those different tests that you're talking about. Once you know the markers, and then based on the markers, you plan the diet accordingly, or give the different herbs or so too. And then after that, wait for, I think, few weeks, and then you should be able to clear it up, right? That's right. The pathway.
Yeah, and it really is so individual, right? Like where somebody might experience a shift in 2 weeks, 4 weeks, or 3 months. Somebody else might need 6 months or 12 months, right? And it's super individual. But and like that's where also the plans are super individual. So, but that's generally how it goes.
The main thing is Correct, correct. Understanding the root cause, right? That's what we're talking
Mm-hmm.
about. Once you understand the root cause, then taking like a rotor here, like a big deep plunger, and make
Mm-hmm.
sure you take the junk out of our body or someone's body and use
Yep.
diet and herbs as the toolkit.
Absolutely.
That's
Absolutely.
fascinating. Absolutely
Mm-hmm.
fascinating.
Yeah, and it's powerful, and I'm still amazed every time I see it. When I'm working with a client and they come back and they're like, I feel like myself again.
And no medication? And you don't use conventional medication like drugs or something?
No, I do not. So I have clients and patients that come to me with on medications,
Mm-hmm.
but I do not prescribe. What I tend to do is, determine what are safe herbs, right? Because I still have to look at interactions. So what's going to be safe for this person if they are on medications, or how can I help support them if their desire is to eventually come off the meds? How can I support their physiology to be able to do that?
Got it. I
Mm-hmm.
think it's
Yeah.
absolutely fascinating that you're able to help
Mm-hmm.
each and every individual based on their personalized constitution, based on their lab
Mm-hmm.
test, and give them a personalized treatment, holistic
Yeah.
treatment without
Yeah.
any medication and help them get well.
Yeah.
That's
Yeah.
an amazing work you're doing, Dr. Eva. Thank you so much
Thank
for
you.
joining us. Yes.
Yeah, thank you so much. Thank you for having me.
And anyone else has a question, you're welcome to ask, but someone just commented amazing, so that's great.
Yeah, I mean, I'm super grateful every day to practice this medicine and just to see the transformations. It
Absolutely.
blows my mind. It blows my mind all the time.
Yes, yes. Well, thank you everyone for your support. And like I said, we have affordable wellness programs to help you out. We're going to work with people like Dr. Eva to bring you whatever you need. So keep us posted of your feedback. Thank you so much. Bye-bye.
Bye.